Hello, my name is Jose Villanueva. I'm gonna talk about the large intestine. We're gonna talk about pathologies of the large intestine from common pathologies to hereditary ones. We're gonna talk projections, how they look like, exposure factors. So after this video, I hope you understand more how and which pathologies the large intestine might be suffering. All right, thank you. So the large intestine is approximately 5 feet long, and the function of the large intestine is to reabsorb fluids, eliminate waste. It has the haustra. It's a series of pouches along the large intestine. You can see them there, right here. Oh, that the teni coli is a muscular band that forms the haustra. It's a little line right there. You can see it right there, all the way. That gives a little bit of more structure of the large intestine. As you can see, the large intestine has a form like a horseshoe form. It has an ascending column, a transverse column, and a descending column. This one will be the last part of the intestine, and then we'll go to the sigmoid flexure, from there to the sigmoid colon, and all the way to the rectum. Burying enemas is a procedure that mostly the doctor used to find certain pathologies around the large intestine. As you can see here, in order to do a barium enema, the preparation is the colon must be empty. Or in other words, the patient has to be MPO at least for 8 hours in order to not have any trace of fecal matter. The patient with some severe diarrhea or gross bleeding or obstruction is has to be considered. And one other thing, barium enemas the procedure can be done as a single contrast or double contrast. When doing barium enema, you have to consider always the patient chart and discuss that with the radiologist. Never force the enema tip in the patient's rectum. The height of the enema bag should not exceed 24 inches or 2 feet from the table. The water temperature should be warm, not too hot and not too cold. And when you get to the post evac, you have to assist the patient to the restroom as quick as you can. Okay, for the first one we have Hirschsprung disease or congenital megacolon. That will be the result of nerve that control the rhythmic contractions are missing. It results in severe constipation and vomiting. It could be corrected with a surgical colostomy. This is how it looks in an illustration here. You see the inflammation of the intestine, of right here of the colon right here. So I'm going to show you now a picture how an X-ray picture how it looks. As you can see here, the congenital metacolon, they took an X-ray. You see that how inflated is pretty much the large intestine. This normally happens at birth. Um, so mostly the one affected are children with this disease. You see right here, all the loop here, all inflated with air, but also the enlargement of the large intestine there. Then we have appendicitis. Appendicitis is an inflammation of the appendix. Cause might be obstruction of fluid flow by the fecalin or the scarring. One of the complications of appendicitis is gangrene, abscess, perforation. Appendicitis is more common in children. Normally, you can see it there. You see the inflammation of the appendix there. And to this time and age, researchers have found that the appendix is part of the body that is not useful for nothing. It's just what they think is just a piece of the intestine that had no function at all, and only causes problems to children because that part there would get all waste could get trapped there, producing gangrene, infections, even a perforation. So sometimes it's better to remove it before it gets inflamed. Diverticulosis is outpouching caused by hemorrhaging of the mucosa and the submucosa through the muscular layer at point of weakness in the bowel wall. Incidence increase with age. It occurs most commonly in sigmoid portion of the colon. Single The procedure that we use for this pathology is double contrast BE. So we can see where does the outpouching are at this moment. Now I'm going to show you a picture how looks under an X-ray image. As you can see, this is a X-ray image of a diverticulosis. We use a double contrast procedure to see where the air and the barrier will go to see the outpouching of the intestines. You can see here it's not a pleasant sight. It's really painful, and when it has multiples of them. I'm going to show you now a next pathology that is close by the name, but it's not the same thing. This is diverticulitis. Diverticulitis is a complication of diverticulosis. It's defined as a necrosing inflammation of the diverticulus. The complication with this pathology is we could have perforation, abscess, even fistula to adjacent organs. It means that the intestine with this pathology could attach or could merge with another nearby organ. Could be with the bladder or other organs in the abdomen. I'm going to show you an image or another image of X-ray image of this pathology. So diverticulitis, like I said, is a complication of the diverticulosis. Images are really similar. As you can see here, how we use a double contrast BE that use air and barium. You see where the air goes up, the area will stay down, and you can see where the pouches are, because the barium gets stuck in the pouches. Like I said before, it's a complication of the tuberculosis, and the image are a little bit similar. It's just a complication, a more severe complication of diverticulitis. Then we have colon cancer. Colon cancer is the third leading cause of cancer death in the U.S. It's more predominantly in males. One of the things of colon cancer, it could be formed or diagnosed from a long-term ulcerative colitis or a familial polyp. It means that it could be a inherent condition, but after some time, it could transform to a cancer. And this procedure, we use a double contrast procedure. As you can see here, it has a distinctive shape of an apple core. This is one of the ways to almost identify a colon cancer. So in conclusion, after talking about a little about the large intestine and his pathologies, we can definitely say that it has inflammatory, hereditary pathologies. We talked about those pathologies, how they affect the large intestines, which one are more fatal than others. One recommendation I would like to give is always to don't wait at the end. Always do a checkup on your body. It could be not every year, but constant, just to have an idea how your body works, how it's functioning, and God forbid if any other pathology may be encountered there. So hopefully this video have you encouraged you and learned more about your large intestine and how to take care of it. Thank you.